Stem cells are very unique cells that we have. It's our spare in the body. And the stem cells have unique metabolism. They are doing anaerobic metabolism in a type of hibernating. And the signal for stem cell to start to proliferate is hypoxia. Now, as you all know, I'm a physician, so I will not take patient and stop their breathing or heart rate in order to induce hypoxia, so the stem cells will start to proliferate. But what's interesting at the cellular level, like it happened in our society, is there is no absolute values. Everything is relative. And the cell, as us, for example, I will feel poor or rich, not according to what I have, according to what my neighbor has. If my neighbor has less than me, I will feel very rich. And if he has more than me, I will feel very poor. Same thing happens at the cellular level. And we are using that in order to induce the sense of hypoxia. What we are doing is when we are taking the patient into the chamber, we are increasing the oxygenation. After it's been increased for a certain period of time, we are doing a fast decrease of the oxygen. And at the cellular level, what is being sensed is the hypoxia. And this is the trigger for the stem cells proliferation. And the stem cells indeed start to proliferate. And what you see over here, these are patients that are coming to hyperbaric chambers to repeated treatment, and we are evaluating the stem cells in the blood. This is the basic after the first treatment, after 10 sessions, etc., etc. And you can see that the circulating stem cells, the one that being induced in the bone marrow, start to proliferate very fast. And in this period, it's like we are going back into the embryonic period. We have huge amount of stem cells that are going all over. We know how it works. We know how to block it today. We understand the process better. And what is very interesting is that we can induce stem cell even at the brain level, at the tissue at the brain, at the glia level, okay, which is of highly significant to everything that is happening in the brain. And we can see over here by inducing hyperoxia and decreasing it immediately, which is synonymous to hypoxia, we are inducing the stem cells. This is a wonderful study done on mice, which are taken into the hyperbaric chamber. And we can see that after hyperoxygenation and decreasing the oxygen fast, there is an increase in HIF. HIF is hypoxic-induced factor. It's supposed to be induced in hypoxia. And here we are inducing him by hyperoxia and then going back fast to normoxia. More than that, we can see angiogenesis in the brain. This is rat and mice. We are not rat and mice, of course. Our brain is different, okay? Completely different. And in a minute, we will see that it happens also in human beings. This is the first study that we have done on post-stroke patient. And without Eshel, I think that all the analysis of the brain imaging that we are doing today could not have done. And I will let you see what's going on over here. This is a combination of the anatomical together with the metabolic imaging of the brain. And by the help of Eshel, we were able now, and now it's routine in our centers, we can see the activity of the brain on the anatomy and categorize it. The blue area are the necrotic area. This area, we don't have any tissue over there, so we cannot rejuvenate, at least not today, anything over there. The green are the metabolic dysfunction area, and the yellow and the red are the well-active area. In this example, you can see that this woman could not move her right hand and leg for 14 months. She's part of the study. And after the treatment, we can see that this area responsible for the hand and leg movement start to be activated, and in this